Welcome to Fahrenheit 140.
Why 140? It's the temperature that water burns after 6 seconds. I'm Robert Mace.
And I'm Carrie Thompson, and we're the Fahrenheit 140 co-hosts covering the news you need to know about climate change in Texas.
Welcome to Fahrenheit 140. This is part 2 of our interview with Dr. Jones about heat and health. And I don't know what articles you chose, Carrie, but I've got heat and health type articles going on here.
I've got a heat and health lifestyle going on over here, so that sounds perfect.
If you missed part 1, you might want to go back to the previous episode to tune in to that interview. Dr. Jones is a medical anthropologist, which is a pretty fascinating topic to be working in, and she examines heat, health, and human rights. And she's been an academic for a long time, but she's now out in the kind of non-governmental organization sector, advocating for communities and governments to get Texas and the world better prepared for heat waves, because heat is a killer.
Yeah, we used to have it all to ourselves, but now all of our friends around the country are enjoying enjoying it as well. And it's really nothing to laugh at, for sure.
Well, note that when you listen, she talked about, we've been lucky so far, and particularly in the Houston area, that they haven't experienced a major power outage during July, August.
Yeah.
And so since we recorded that interview, barreled into the scene. The hurricane came through, and as we sit here today and record this is what, day 2 of power outages down there.
Yeah.
With heat indices, I think at 105. You know, I've got some friends I can see in social media that are kind of struggling. You know, they don't have power, which means you don't have AC.
Right.
So that's alarming, and just shows the vulnerability, you know, Texas has to these issues, particularly as temperatures keep going up.
Right. And we'll talk more about Hurricane Beryl, but I just wanted to share a few resources that Dr. Jones shared with us for folks that need information about cooling centers or seasonal shelters. You can go to tdem.texas.gov/cool, and you can find out where you can go to stay in the cool. You can also dial 211 to help locate that nearest cooling center. We're going to have some other helpful tips for staying hydrated, and hopefully a little something to give you some hope at the end of the episode. So, shall I kick it off? I could just give you a few more facts here about Hurricane Beryl. That was one of my articles.
Was it? Let's do it.
Okay. Yeah, I went ahead and pulled 2, because the numbers, like you mentioned, we're in day 2 or 3. I'm not sure anymore, but initially, though, we were looking at power outages for 2.3 million people.
Wow.
That is so many people. It breaks down. I haven't counted this, but it looks about like 12 counties affected and across that area. Another thing highlighted in this article is the number of people that are sort of vulnerable and already at risk. There are over 200,000 people on Medicaid, and just, vulnerable populations that are already at risk. And then, of course, losing power and being in this heat is very dangerous. The article also kind of highlights some of the issues with getting supplies in and out under these conditions, and even access to fuel. And then as of today, we still have more than 1.7 million people without power. So they've got 500,000 people back online, but that's an incredible number. Lack of air conditioning, like you mentioned, Robert, and the humidity. Cell phones are down. Yeah. Internet. We were just chatting. I just saw an article called Free for All in Houston, with the traffic lights are all out. Officers receiving 100 calls of carbon monoxide leaks, broken gas and electricity lines. This is really serious stuff. And this is the earliest Category 5 hurricane
That's
on
right.
record in the Atlantic. There was a note I saw that the closest runner-up was the year of Hurricane Katrina. So it doesn't bode well. I think it's not this won't be the last time we talk about hurricanes this year.
And it's been interesting too that so far this season that either the hurricanes, the storms, or the tropical depressions have either started or passed through the lower Gulf Coast.
Yeah.
Every single one of them. I think there's been 5 in total in the categories. So far there's only 2 official named tropical storms. But yeah, so something's going on where we're seeing a lot of storms, but it's just interesting how all of them have been so southern. Don't wish a hurricane or a tropical storm on anybody, but it was a little disconcerting that it didn't come up into central Texas and filled up our aquifers and our reservoirs.
Yeah. And I think I saw a number of articles just speaking to the scientific certainty. I'm not saying it's my certainty, but that this is directly related to climate change and the warmer temperatures. Warmer water temperatures and conditions are directly linked to climate change, which is why we're talking about it here.
Yeah, forget the exact number, but it's like of the warming that we experience on the planet, 80 to 90% of it gets absorbed by the ocean. And so we see much greater ocean temperatures, and that's feeding these storms.
Yeah.
It's making them more intense. So yeah, little disconcerting.
Oof. Yeah, it just stay safe, Houston. We're thinking of you.
So I have an article. I was looking for heat and health articles, and this is an article from Texas Tribune. Actually came out in January, but it noted that 334 people in Texas died last year from heat. So in 2023, that's according to data compiled by the Texas Department of State Health Services. And that was a record year. And twice as many people died from heat in 2023 than in 2011. I do know the heat data is a little shaky, doesn't always get recorded, but just another kind of indication of increased temperatures and increased exposure. It's creating health issues. Maybe a takeaway that folks can apply is just watch yourself in the heat. This article starts off about Don Green fishing on the Brazos River, not realizing that he was getting overheated, and when his body temperature reached 110 degrees, 86 years old, 1 hour, it killed him. And
wow. Oh my God.
So just have to watch yourself. Yeah. Make sure you stay cool. And then as Dr. Jones has discussed, each of us reacts to heat differently. So that's this is the bad news segment.
I know. Wow. Well, I don't know. This one is actually not bad, but I pulled one on FEMA is changing its definition of floodplain. And I know we talk a lot about floodplain mapping here at the Meadow Center. And so this is stemming from an executive order from President Biden, and it's kind of a significant shift. So one of the things that for those of you who have paid attention to floodplain mapping, like when you buy a house, it'll say you're in the 100-year floodplain or the 500. We've known for a long time that those are not up to date. And we also know that that's a challenging concept for people to understand. And so you do end up getting a lot of building in the floodplain and then a lot of damage when these storms are happening, right? And now they're more and more frequent. So one of the things that's been happening slowly, community by community, is there's this Atlas 14 update that's happening where in the past, FEMA would only look at what happened in the past, and now they're trying to account for what we know is happening with climate change. So the result is that when they do rebuild in one of these zones, they're going to fortify those buildings differently. They're going to require that they be built higher at higher elevations or further back from maybe the river or the coast, and try to enhance resiliency as well as just get out of the way of places that we know are definitely going to flood. I highlighted this sentence. After Hurricane Harvey, speaking of Houston, that was in 2017, Houston updated their building code to prohibit construction in the 500-year floodplain, which is pretty conservative, definitely compared to other communities. So it forced builders to elevate the homes and build them farther back from the river. And this standard likely has prevented thousands of people from flooding this week during Beryl. Wow. So that's really encouraging. I have been involved in this with the city of Austin, and it's been interesting. They actually used to have a very protective standard where they would not allow you to rebuild in the flood zone. They changed that last year. So now you can rebuild anywhere even in 25-year floodplain.
Wow.
Which means, basically you're flooding all the time. But now they require that you build up. So you have to put your house on top of stilts or like a big slab foundation. It has to be high enough that it will move the house out of that flood zone. It's a little concerning to me because when you have like a rescue operation or if people really are flooded, they're literally on an island, that no one can really get to and they can't get out. So it's interesting choices that communities are making right now.
And it's a moving target too. So that like the updated Atlas 14 that you mentioned for Austin, what used to be the 500-year floodplain is now the 100-year floodplain. And the trend really all along the hill country is the floodplains are expanding. Those intense rainfalls are getting more intense.
And we're building more. And the models don't really account for all of that.
That was the other thing I was going to say is when you start building in the floodplain, that impacts the flooding.
Right.
So there's a feedback loop in there. Like Houston, I think the technical term is freeboard. So
yes,
it's
right.
It's like you can build to where you're just out of the floodplain.
Right.
But that's not a guarantee you're not going to get flooded.
Right.
There really is no guarantee you don't get flooded, but you can reduce that risk by building higher and higher.
We're all potentially in a floodplain the way things are going.
Yeah. The other article I have is published by the San Antonio Current titled Dangerous Texas Memorial Day Heat Made 5 Times More Likely by Global Warming. And essentially it's noting that these heat waves that we're in, high pressure heat domes they're just far more likely because of the warming trend that the planet is under. And we're probably going to continue to see more and more of these and see the temperatures go up. There's some charts out there that you can look at on like heat stroke and heat indices that are interesting because so the kind of the feels like temperature that you see, the heat index temperature, you really want to be careful when that's inching up to 130. I don't know that we've had 130s in Texas yet. We have seen those in other parts of the world, but that's, if you're not in a conditioned space, you're in deep trouble.
You're in trouble.
The danger zone starts about 105. I'm a little concerned about Houston right now with heat indices at 105. That's what they were yesterday. I don't know what they are today. That's concerning. And then extreme caution is heat indices really at the 90 degrees, but it's pretty much, extreme caution in the lower 90s.
Wow.
Danger zone 105 and up, and extreme danger. And by extreme danger, like potentially killing you. Really, everybody's susceptible to getting killed by the heat, 130.
Wow. I'm thinking about those 1.7 million people right now that don't have air conditioning.
Oh my gosh, yeah.
And they're, gosh. You think about how many people are working outside too. It's just, Well, thanks, Robert. How about we transition and go listen to the second part of that interview you did with Dr. Rose Jones?
We'll listen to a real expert. How would you rate the policy response to all this at this point?
The policy is, I will say this. I tend to be an optimist by nature. I think that the good news is that there is growing awareness that we need to do something. But as I, mentioned earlier, we are so far behind that this needs to accelerate really quickly. So I'll give you one example. FEMA doesn't recognize when they define, natural disaster, heat is not included, nor are wildfires. Okay, those are our two big issues right here in Texas especially. So that means there's a lot of funding that's not going to help people with insurance and all of those other things that escalate. The other thing, and this is really, I think, super important for Texas, is that OSHA, which mandates all of the labor practices, keeps our workers healthy and safe, doesn't have any protection. There's no national policy for workers, indoor or outdoor. And most experts will tell you that we're probably 10 years from OSHA having something in place. And why that's important in Texas is another equity issue. Is last year, Abbott signed it in September 1 of this year. House Bill 2127 went into effect. And essentially what House Bill 2127 did was it stripped away local government's ability to make ordinances, multiple ordinances, one of which was construction workers in Dallas and Austin lost safety issue of mandatory water breaks and mandatory shade breaks. And for context, Florida signed a similar bill last month, I believe. And so think about this. When you ask me about policy, where are we? Not only are we behind in making proactive policies to protect people from heat, but in this case, we have states like Texas and Florida that are actually taking away safety rules and protection. Texas has already, before you factor in heat, one of the highest incidents for worker-related mortality in the country. Wow. So when you throw in, and most construction workers, I think the majority, 6 out of 10, are Latino. Many are undocumented. They are not going to argue for a water break. So it becomes imperative that we have policy in place. And I guess I'll say one more thing. I mentioned earlier, cities. If you look at heat action plans in Texas for cities, again, it needs to be more than just one approach or two approaches. We all need to be developing heat action plans that are systemic, holistic, grounded in public health, and grounded in equity. And we're not even close to that. That's why chief heat officers, the new position that we're starting to see pop up in a few cities and internationally, those are the type of municipal roles that are going to be critical. Phoenix has a chief heat officer, and they just appointed the first ever position for a state chief heat officer that will implement a climate action heat plan that they just put together.
And then we have perhaps somewhat unique to Texas with our own electrical grid, kind of the uncertainties that come in with the grid. So many of us have already experienced that with Winter Storm Uri, on the flip side, where we had no heat. And, I had friends that were literally breaking apart furniture to burn in their fireplace, and they were fortunate to have a fireplace. Last summer, we flirted with potentially rolling blackouts, and then ERCOT just testified in a legislative interim hearing that maybe there's a 30% chance we have rolling blackouts or don't have enough power coming up in July and August. Any thoughts? Any thoughts on that? Because sort of like, what is your heat plan when the whole damn grid goes down?
A really good point. And I do have some thoughts. I think Houston was lucky in the sense that the flooding and the blackout didn't occur in July or August. From where I sit, this is not a question of if this is going to happen, it's when it's going to happen. There was a really interesting study that was published last year. They took 3 cities. I think it was Phoenix, LA, and Atlanta, I believe. No, maybe it's Chicago. Anyway, here's what I remember. They took, so of course, Phoenix is extreme heat, and Atlanta was somewhere in the middle, and I think it was an East Coast city as well. And what they did was they projected, okay, let's say, for whatever reason, electrical grid goes out during the heat of the summer, what does this look like? And it was frightening over a 2-day period. What they found is that in Phoenix, they estimated that as many as 800,000 people would need medical attention.
Holy cow.
Yeah, it's huge. And over 1 million would die. Like, these are frightening perspectives. And so to look at this data and know what our vulnerability is. As I mentioned earlier, we live under this sort of falsehood, like, well, we have AC, right? What if it goes out? What if we can't afford it? It's a public health crisis, quite frankly.
You mentioned this earlier, where it becomes on a person-by-person basis on how susceptible you are to heat. Then you have the temperature component, but then you also have the humidity component. And I guess when those 3 things can intersect and be deadly. And, given the high humidities, we normally have in Houston, it doesn't have to be as high a temperature as you see in Phoenix
That's exactly right.
to be in a fatal zone for folks. And it's only going to get worse. And the increased temperatures increase humidity. So you're getting it on both sides of that equation with the increased temperatures.
Another really good point. That's when we factor in the humidity, that's what we refer to as a feels like heat, right?
Mm-hmm.
But to your point, yes, you can't just look at ambient temperature. And as you mentioned earlier, an individual. Yeah. So an individual, what are their underlying conditions? What medications are they on? There are some medications,
Good point.
especially with diabetics, heart patients, that will be even more so adversely affected from the heat. And that's what makes it super complicated, right? It's heat, it's the ambient temperature, it's humidity, and then all of these individual risk factors, as well as your own vulnerability for, where do you live? What are your resources? Do you have to go to work in the heat?
When I think about kind of Texas in general, not doing a whole lot about climate change, my fear is it's going to take something really scary happening to wake the state up. Unfortunately, it could be one of these heat disasters, which could be quite sobering.
I've pondered the same thing. What will it take? I just finished rereading, I should say. It's really quite excellent. The book is called Heat Wave, A Social Autopsy of Extreme Heat. And it was in Chicago. So it was the heat wave that happened over a week period in 1995 in Chicago. I just happened to be there. I was finishing up some work. I was living in a dorm at the time. I couldn't even lift the window. In Texas, we're used to the heat. We have air conditioning, but that's not true for all places. Anyway, it's a really riveting book. Ultimately what happened within the span of several days is 700 people died. Most of them were Black. Most of them were elderly. Most of them lived alone. Hundreds of people died in their apartments and houses. And what happened? We moved on, right?
Mm-hmm.
So I have pondered that as well. What will it take? I hope that you and I are both wrong. The information is there. The data is there. So it's a question of how do we get policies in place and advocacy moving in that direction.
So given that, do you have any resources that you can recommend for Texas communities, for Texans or Texan medical professionals to learn more about heat and to be better prepared for it as we go forward?
Here's the problem. So when we do public health, we have messages that we export and, you start raising public awareness and here's what you can do to keep safe, et cetera. This is a problem that goes beyond that because it's not just a question of educating community members about how to stay safe and what the heat impact is. We're trying to educate an entire healthcare workforce. And so what we have right now are generic messages. So for example, stay hydrated. That can mean lots of different things to lots of different people. Some people think staying hydrated would be consuming Kool-Aid or beer, all of which can be counterproductive. Messages have to be really tailored to the community that they're designed for. When you start exporting generic messages, sometimes you can create more harm than not. And so I'm always a little reluctant to say, yeah, here's some great tips. When I first started doing this work, I started looking for exactly that information. I actually found more information and tips for how to keep your dog safe than people. And I still see that.
Nothing about cats?
Nothing about cats. So there's a problem.
Yes, that is a problem.
And the other generic messaging that I see all the time with heat is go to a cool place. We need to do better than that because what we need to be doing is, are you in your third trimester of pregnancy? Here's what we need to be cautious about. I'll give you a quick example. I interviewed a nurse during the middle of the record-breaking heat that we had, and she was doing home care. And most of the patients she was working with were not mobile, really significant health problems. And I asked her, I said, are you seeing anything with heat in your patients? And she looked at me very oddly. And she said, as a matter of fact, I think I am. I'm having to order twice as many IV hydration kits. And she started telling me, I never really thought about it until I did home care. Some of my patients they're in the back of their room. They don't have air conditioning on. And so I asked her as a follow-up question, I said, well, where are you getting your training and information? How are you getting supported to do this work? And she said, all of the training that I received on helping people deal with heat and health, I got when I was 16 years old as a lifeguard at the YMCA. You got nothing in medical school. I mean, nursing school, rather. For me, that really sort of resonates the whole point. When I did HIV work, it was really about helping the community to understand what the risk factors were, right? We've got a whole battalion of healthcare physicians, nurses, PAs, all of them that are not themselves trained to recognize what we need to do. And so it escalates the problem in ways that require us to really uniquely revision what we're doing. To your point earlier, we talked about, well, it's not just water, it's heat, air quality, all of that. We've got to start thinking that holistically. And the same thing is going to be true when we look at public health interventions and messaging and climate action plans. We're still working in silos. And there's a lot of rhetoric and a lot of optics about, yeah, we're trans interdisciplinary. I don't see it.
I did my own personal research last year on heat stroke. I didn't realize, although in retrospect, it's thinking about it, it's like, oh, it makes sense. But like, I know myself, if I'm outside and, in the heat, all of a sudden it's like somebody has turned on the sweat faucet. Mm-hmm. And so reading the guidance, I'm like, oh, I'm overheating at that point. It's my evaporative cooling system is no longer functioning. Now I know what that means, rather than, I'm getting a great workout, but it's like, I'm now like stressing out my body and increasing my core temperature. So there's a lot that folks definitely need to do. What can people do to support you and the work that you're doing?
Build awareness, specifically in Texas, about the policies that we have in place, House Bill 2127 and its impact on workers. The other thing is, what about our vulnerable communities, like people who are not sheltered? One of the lessons we learned last summer is that cities like New York and Phoenix, they had cooling centers that were not being used. Okay, there's a disconnect. It needs to be more than just, oh, we have a cooling center, check. Can people access it? And if not, why not, right? So I think that that's helpful. And I think the other thing, one of the lessons that came out of the Chicago heat wave, where so many people died, was really making sure that you're checking on people in your community. Like you can literally organize groups, or if you have a neighbor, go knock on the door. How are they? More people die in their homes at night during heat waves than other times. The bodies just don't cool off. And when you live alone, literally days can go by before there's an intervention. One of the things that I think that's become really innovative and I think might be helpful to your audience, seeing really good momentum, is really community efforts, community campaigns. There's some really interesting work that I saw coming in the Black community in New Orleans. I'm from New Orleans, so I'm most familiar with that area. And what they sort of recognize is the government's not going to save us. We're years away from policy. What do we do? So they've begun to organize community level workshops where they're educating people and each other about, this is what hydration means. Here's where you can go. Let me get you a bus voucher to go to that cooling center. So I think that while we wait for some of these big items to sort of take off, that there are things that can be done at the community level, which is, really supporting each other, learning about how we can do that. And then the whole policy of making sure that, well, how can we protect our workers? Is that really, where we want to be as a state? Those are some concrete things that can be done now.
Very good. So any final thoughts you'd like to leave our listeners with?
I just would like to say that, I guess in summary, that truly this is a public health crisis. They often refer to heat as an invisible problem, an invisible public health. And the best analogy I've seen is, imagine that you're looking out your window. You can look out your window and you can see, oh, it's cold, I'm going to need a coat. Or you can look out your window and see destruction from
tornado coming down the street.
Right. Oh, there's smoke out there, right? That's not true for heat. It's really critical because it's an invisible problem, if you will. Oftentimes it's secondary to all the other issues. It's an invisible public health crisis, but it's about to get a lot worse.
Yeah, and unfortunately, it looks like we've got more heat on the way. So, well, thank you so much for your time, and thank you for everything that you're doing to make the world a better place, make Texas a better place, and for us to be more resilient against this heat we're going to see more and more.
Likewise, I really appreciate the work that Meadows is doing as well.
Well, thanks again to Dr. Jones and all that good information and the good work that she's doing to protect health and human safety here in Texas, across the country, and the world. This is going to be absolutely required as we go forwards. It's going to be a while before temperatures start coming back down. This is going to be a growing problem and definitely something we need to address. So here's some quick tips for staying hydrated. Dr. Jones mentioned this, and producer has a registered nurse in her family, Patricia Cloyd-Santos. Some tips for staying hydrated. And we heard this from Dr. Jones as well, and this was news to me, so this is good information to me. Beer alone will not keep you fully hydrated. Oh, I'm sorry, water alone will not.
Yeah, I don't
keep
think
you fully...
she came in conclusively on your first comment. So keep that up.
But water's not enough. And when you're sweating, you're also sweating out salts and minerals.
Right. Beer
is probably not a good idea to be drinking when it gets, really, really, really hot. Margaritas probably also not a good idea. What you really need is drinks with a balance of salt, sugar, and water. And so Gatorade is a good drink. Not that we're endorsing anyone specific, but sports drinks. There's a number of sports drinks out there. But don't get too sweet.
Those other powders, like I use this one called LMNT.
Oh, do you? Okay.
And it doesn't have sugar, or it has very little sugar.
Element. Is that how it's pronounced?
Element. That's right.
Yes,
Isn't that catchy? And liquid IVs out there too.
If buying sports drinks is not possible for whatever reason, consuming strawberries, watermelon, cucumber, pineapple, tomatoes, and lettuce can also provide the sugars, lettuce. The salts. Yeah, that's also healthy too. So, disclaimer: we are not medical professionals,
nor do we work for Gatorade.
So be sure to speak with a trusted medical professional for more tailored advice to you and your needs.
Well, thanks, Robert.
Yes.
Should we go to some good news?
Let's go to some good news.
All right. I talked to Sarah, our producer, and wanted to celebrate HEB making hurricane cupcakes, but she said that wasn't good news.
Oh.
So
I saw a full-blown cake.
Oh, HEB?
Yeah. Which is, I think it's awesome, actually.
I mean, it's sort of like a great communication tool when you know those are out. My article's about this new effort in Congress. It's about fast fashion. Have you ever heard that term?
I have.
Fast fashion. You see a lot of stores now that make very affordable clothing that sort of mimics what you see on the runway. So it tries to be very trendy. Mm-hmm. And they're always cranking out like this season's new thing and a total turnover for each season. And a lot of that fashion goes straight into the trash when it's out of fashion, right? It's made very cheaply. Usually the people making it are woefully underpaid in other countries. And so there are all kinds of human rights issues associated with it. But what shocked me is that actually accounts for 10% of global carbon emissions. Wow. 10%. Wow. That's more than international travel.
Wow.
They have a note in here. There's a gargantuan landfill in Chile in the desert filled with clothing like H&M, Nike, Levi's. The garbage pile can be seen from space.
Wow.
We give these things to Goodwill, or we don't know what happens to them, but they're being shipped off to other countries and they're just going into landfills. So what I think makes this good news is both it's being addressed, that there's this new caucus formed in Congress and they've got eyes on this, but also it's something else that you and I can do. And I always feel like when we can find something that where we're empowered.
Not that I'm terribly fashionable.
Oh, well, he is wearing a dinosaur shirt right now, which is pretty nice. And I bet you keep it for a long time.
I do.
But yeah, I think this is just a reminder that we do have some power in the way we make our choices as consumers, and reduce your purchases, reuse the things you have, recycle them, give them to someone else that could use them. Be thoughtful about what you're buying. Anyway, good news.
My good news article comes from my alma mater, University of Texas, they're teaming up with the city of Austin on helping to apply research to making cities more climate resilient. And it isn't so much on the water side as it is on the kind of the heat and the health side. And so, Austin has an Office of Resilience. Part of what they're doing is kind of looking at these heat waves and building resilience for cooling centers, so disadvantaged folks, homeless folks have a place to cool off and not be adversely affected by heat. I kind of like how it's a way for academics who are on the forefront of the research, familiar with the what the research is saying in terms of best methodologies, are getting involved.
Okay.
We do a little bit of that here with maybe a lot of it actually. We're certainly doing a lot of work on the water sector.
Yeah.
But Dr. Zoe Mint, who's Meadows chair over in the Department of Geography and Environmental Studies, one of his topics is looking at benefits of tree canopy in cities for reducing heat island effects and providing shade and respite from high temperatures. There might be a temptation for water stressed cities to we're just going to get rid of all outdoor watering, including in public spaces. And any Texan knows that you head down a street and there's not a tree on it. It's
misery.
Kind of a neat way that kind of the cutting edge research can bring the research to bear to help create a more resilient Texas.
Yay. Well, thanks for that, Robert.
See, I have good news in me.
Yeah, you get so much good news.
And I'll say this, bad news is good news too, in the sense of if there's bad things happening, it's an opportunity to understand them and understand those issues and then do better next time. So,
and I think what we're trying to do is highlight all the linkages. We all hear about climate change and it's hard to understand what that means, but it's showing up in every facet of our life. So I think that's what we're trying to do here is just explain how these things are connected and those actions that we take are going to matter in a lot of different aspects of our lives.
And I went through a whole episode without saying the word poop. So that's
you
really,
almost
wait a
made
minute.
it.
Oh,
gosh.
Right. Till next time.
Goodbye, y'all. Take
Bye.
care. Thank you all for being with us for another climate conversation. We hope you can take this information with you into your everyday life to help spread the knowledge and understanding of climate topics and their effects.
This podcast would certainly not be what it is without listeners like you. If you're listening through Spotify, take a quick moment to help us out and engage with the quiz and poll we've attached to this episode. And be sure to check the show notes for helpful links and resources.
Thank you to our funders for the Fahrenheit 140 podcast, both the Meadows Foundation and the National Oceanic and Atmospheric Administration. We'd also like to thank our communications team, Anna Huff and Sarah Wingfield.
If you'd like to learn more about the Meadows Center for Water and the Environment and how to visit our vital spring lake for a ride in a glass-bottom boat here in San Marcos, Texas, be sure to visit our website, meadowcenter.txst.edu. We have a number of climate resources there, including free lesson plans for your K-12 curricula. Sign up for our newsletters to get news, updates, and event opportunities hot off the press. I'm Robert Mace.
And I'm Carrie Thompson. Thanks for being part of the conversation.